Today we're going to talk about validating concussion through brain imaging, which may be a teeny bit of a deceptive headline there, but stay tuned.
Not intentionally deceptive.
Not intentionally, but if you have concussion symptoms, but you've been told all of your imaging is normal, then I would stay tuned. It's not going to be a long video. We're known for long videos, but right now we're kind of in fine-tuning mode, so most of our videos are getting much shorter. I'm Dr. Martin Rutherford, certified functional medicine practitioner, chiropractor here in Reno, Nevada, at the foot of the Sierras.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
And we are going to be talking about validating concussion through brain imaging. And the reason we're going to be doing that is because we do a lot of post-concussion work. Dr. Gates is a board certified functional neurologist. I am a certified functional medicine practitioner. We have put together two disciplines to address chronic pain and chronic conditions. And concussion is a chronic condition that really, the model for taking care of it is poor. Part of the reason it's poor is because the way of determining whether the patient has it is poor. And there are two aspects to taking care of it. One is a chemical part. Another is rehabbing a brain. It's not firing right. And that's how we put our two disciplines together to address these things. Having said that, there's virtually, if 100 people come in here, if 100 people come in here with concussion, a handful come in with a MRI finding. The vast majority come in with all my imaging is normal. My MRI is normal, my CAT scan is normal. And that's really kind of the meat, I think, of where you're going with this, right? We talk about this like sometimes like 30 seconds before we do this, or not at all.
Right.
so I'm assuming,
because I'll research through the night and then I'll come in and.
So I'm assuming that's where we're going with this. So validating concussion through brain imaging. If you're watching this because you have concussion symptoms, this is going to be pretty good. I think you're going to really find there's going to be a lot of good data here. So I'm sitting there, I'm doing the intakes. I'm trying to value whether patients are coming in or not relative to are they good candidates. They shove all of their blood tests in front of me and so on and so forth. And usually I say, so basically you're telling me you have all kinds of concussion symptoms. You've looked online, it sounds like you, but all your imaging is normal, right? And they'll say yes. And so then at that point in time, it's kind of an explanation as to why that is, and you're about to get that explanation and probably then some.
So it's common for any diagnosis where patients want a lab test to prove that they have it, or they want an imaging finding that shows that they definitively have this problem. We were just talking about another condition where the neurologist said, well, there's no lab test for what you have, so I can't technically diagnose you with it, which is a travesty, because neurology has changed away from being a clinical practice where you're an excellent historian and you figure out the problem based on the individual's presentation, and it has switched to, we just want an MRI finding. Now, for those of you out there in the concussion world, you know this because most of you have had an MRI or CT, as Dr. Rutherford said. It was normal, yet you continue to have a plethora of brain-related symptoms. Now, the reason why I wanted to bring this to you with this title, Validating Concussion Through Brain Imaging, was because there is a lot of research being done right now on people like you who have had head injuries, you're still having symptoms. The medical community, the scientific community knows that the MRI and the CT scans are relatively useless for you, except in excluding, like a horrible brain bleed or something like that. But even then, most of the time, most of you don't even have microhemorrhages in your brain MRIs or CT scans.
So they're too gross. They don't show enough detail to really tell you what's going on in the brain itself.
Because we're looking at it with, it's a really good point. So we're looking at from what our eye can see on an MRI, basically. So is there a tumor? Is the tumor 1 centimeter? Is it half a centimeter? These are all details that we can see. But to really illustrate and understand what's going on with a post-concussion syndrome patient, you have to see the brain at almost like a nerve cell level. So a microscopic level. Or you have to be able to see differences in blood flow that are happening in different areas of the brain. So just as an introduction, One of the techniques is functional MRI imaging. Functional MRI imaging really tells you how much blood flow is going to one part of the brain. They can see how different parts of the brain light up if they give an individual different tasks. So they have you look at something and what are you thinking? And they compare your brain to someone who hasn't had a concussion and they see what's going on. Other types of imaging that really show a lot of promise is something called diffusion tensor imaging. It's a type of MRI technique where they can actually go in and see what's going on with think of the highways of the nerves. They're called axons. So the nerve has like a brain within your brain cell. So within your brain, you have many brain cells, and these brain cells have a brain part to them, and then they have like a highway. And the highways tend to really get damaged in concussion because lots of times with concussion, there are rotational forces where you hit your head and then the brain may twist. And when the brain twists, it's like wringing a towel. Then these highways get stretched, they get tractioned, and then they can see abnormalities on this diffusion tensor imaging as to what's going on. So those are the two most, go ahead.
And you said that almost like they were available, and then you kind of said these show promise.
They show promise.
So they're still in the research experimental.
Right.
So don't go out there running out there and saying, tell your doctor you want these tests.
Mm-hmm. You may be able to get one at like a specialty center or a research facility like a university, but most imaging facilities, just keep in mind, I mean, they're there to do the standard MRIs, the standard CT scans, almost 24 hours a day. Most of them, because that's what the insurance pays for, and that's what they do. So if you've had a concussion, these types of imaging modalities I'm talking about are not completely available to everybody in the population, but you can call different research centers and say, hey, I've had a concussion, would you consider doing this? Because frequently the reality of the situation is we've seen a lot of concussion patients where there's a burden of proof because a person gets hit and then all of a sudden, you know, they can't think, they can't function, they're crying all the time, they have post-traumatic stress disorder, and the other side is saying, you just bumped your head, you know, and it makes no sense why you'd have these symptoms. Now, in my world, the board certified chiropractic neurologist, my mentor went heavily into eye movements and diagnosing concussions and validating that there are things that are wrong with concussions. A lot of new research is coming out of Canada where they're substantiating that. My mentor just published a paper where he took this group of concussion patients where they weren't getting better. It's now been shown that if you haven't improved after 3 years and you have post-concussion syndrome, you're probably not going to improve. So he took this group of long-standing post-concussion patients and he got them better by doing
that guy was wrong.
by doing eye movement rehabilitation techniques, basically, because the way the eyes move is heavily controlled in the brainstem. And like I talked about, that towel gets wrung where those pathways specifically that get twisted, lots of times are in the brainstem. And so he's had a lot of success with that. We've seen a lot of success with it with our approach. But saying all that to say, probably in the next 5-10 years, you're going to see something come out where there is an MRI or CT spectroscopy or some sort of imaging modality that's going to allow us to see what's going on in the brain of a concussion patient and differentiate it from someone who doesn't have a concussion. So just kind of want to bring that to you because I know a lot of you feel like you're floundering out there, and there is hope on the horizon. There's a lot of good research being done. And really at this point, it is validated. You can say, you know, there are abnormalities on imaging with post-concussion patients. That's been proven now via DTI, diffusion tensor imaging, via functional MRI. We know a lot about this, but there's no one single test that hasn't gone through a 2,000 patient study doing this one test compared to controls over 5 years to say this is the one test for post-concussion syndrome. Because you as a patient need to understand that's how our healthcare system operates. And so when people say there's no research, lots of times there's a ton of research, but what they're implying is that there hasn't been this huge study comparing 2,000 people to controls, doing this one imaging technique. Everything was controlled for, and we found that there was a statistical difference.
Yeah, and I mean, from the practical aspect, that came out of car accident cases. I mean, back in the 80s, nobody believed there was whiplash, and then ultimately there was data that started to come out that whiplash actually was correct, and then the attorneys started to figure out a way to litigate it in court and say, well, there's no imaging here, and and the X-rays are all normal. So the X-rays are all normal, and the bumper wasn't busted, became their mantra, and then that was picked up on everything, like you don't have a concussion. And then the other thing that you mentioned, it became the insurance companies. The insurance companies don't want to pay for it. So then they just put in a caveat that there was demand that you had to do all of these tests. Okay, so that's just a little bit of the practical aspect of why it's there. It's not that your doctors are jerks and idiots, okay? It's that that's what they have to work with. So if I'm sitting out there and I have a concussion,
right,
and I've had many of them, and I am doing much better. One last thing, and I don't know that you intended to put this in. Dr. Gates generally comes up with all of the research and data on this. So if there's no way to tell about me having a concussion, how do you guys figure out what's wrong with the concussion?
So
I think it would be valuable for them to understand that you can still diagnose.
Yeah, absolutely.
Without the imaging. If there were imaging, no doubt it would be helpful to be a little bit more confirmatory.
Right. So technically, post-concussion syndrome specifically, because that's where a lot of you are watching this broadcast. Some people get concussions, they're better in 2 to 4 weeks, they're out of it. The concussion folks usually have had symptoms longer than a month. There's some disagreements. Some people say it has to be longer than 3 months. Needless to say, it becomes a clinical diagnosis. Guess what else is a clinical diagnosis? Parkinson's disease. Okay, we don't have a lab test for Parkinson's. Just recently now, in the last few years, we have some imaging studies for Parkinson's, but most of the time, Parkinson's is a clinical diagnosis. So
clinical diagnosis means diagnosis through history and exam findings and as criteria that has been set out.
Exactly. And so with a clinical diagnosis, you have to take in several factors. As Dr. Rutherford said, you have to do a really good history. You have to do a neurological exam. But with the concussion patients, you have to go further. Some of the balance tests with a concussion patient need to be done on an unstable surface, for example, because that will really tell you if they're normal or abnormal. And you can look balance and post-concussion syndrome, you'll see a variety of scoring systems come up, but those need to be considered. Neuropsychological testing also can be considered in some cases. Now, neuropsychological testing is not a standalone measure of concussion, nor was it meant to be by most references. So that's where you come in saying, I'm having trouble thinking, I can't remember my wife's name, I'm losing my words. So the next step becomes, let's send you to a neuropsychologist, basically a psychologist.
I'm depressed, I have anxiety.
Right.
And I didn't have any of this before the accident.
And so what they do is they put you through a battery of testing, looking at how quickly you can think, how can you remember, are you faking it? On and on and on. So that's the purpose of the neuropsychological testing. It does have validity. One of the more common rapid neuropsychological tests out there for head injury is called the impact test. We support the impact test. We think it's good because it's easy to do pre and post measurements for those of you who are athletes. A lot of teams now are doing an impact test before the season, an impact test if you have a head injury. That way they compare, okay, Joey was here in August and now it's October, he just got his bell rung and he's not thinking so clearly and he's performing poorly on a number of measures. That's a really good thing. And then there is what's termed oculomotor testing. There are more sophisticated names for it, but oculomotor testing is sufficient. So what that means is it's eye movement testing, because like I said, the brainstem tends to be vulnerable in a lot of these concussions. And there's a neurosurgeon, I believe his last name is Ellis. He's Dr. Ellis out of Toronto. And he went in and he started looking at abnormalities of these eye movements, which is typically done for patients who have inner ear conditions or balance problems, which many of you have. So he went in and he studied eye movements as it pertained to pediatric concussion. And he found that if these young athletes who had had a concussion, if they were getting dizzy, for example, if they were following a target moving back and forth, or if they're getting dizzy and nauseous, moving their eyes from right to left or left to right quickly, or if they weren't doing that statistically well, that was a predicting factor for post-concussion syndrome. So we are on board with Dr. Ellis, and that's a lot of the data we use in our clinic to validate something is wrong in the brain, because you may be thinking, eye movements, really? Yeah, eye movements, thousands of references for each type of eye movement.
There's a whole textbook on it.
Yeah, from the author is at Johns Hopkins. Most of the research is done in very, very prestigious facilities because they want to know how the eyes move because it accurately traces to certain parts of the brain. For example, if you're following a target going side to side, it's a completely different part of your brain than if you're looking quickly from right to left or left to right. And it's different than if you're looking at telephone poles as you're driving down the freeway. There are all these different measures you can use to say, okay, this part of the brain is working or not working. And then from that, like Dr. Rutherford said, what do? We create a rehab for what's not working. So if your certain part of your brain was damaged in the head injury, then we want to get that part of your brain working again. Pretty simple concept, right? But it's not commonly employed out there. It's like personal training for your brain. But it gets a little complicated because if you damage your left frontal lobe, for example, and it's very sensitive metabolically, then you don't necessarily want to go in and stimulate the left frontal lobe because that would be like telling someone with a torn hamstring to go sprint as fast as they can. So sometimes you have to go in and rehab other parts of the brain that may have had a little bit of damage and talk to the left frontal lobe to get it working better. And then in addition, the other factor that's associated with post-concussion syndrome, you can watch our other broadcasts, the blood-brain barrier breaks down, the gut barrier seems to break down, hormones tend to become disrupted, stress hormones go up dramatically. I can't give you a study on this, but almost every post-concussion patient I've seen has had autoimmunity to their thyroid. So it seems like the gut breaks down and that triggers this whole host of inflammatory responses that then go into the brain, possibly the thyroid gets attacked, on and on and on. These are the vicious cycles going on, so to speak, that are not allowing a concussion patient, post-concussion patient, to basically resolve their symptoms.
Yeah, so you can diagnose it currently today if you understand that the tools are there and if you're willing to do it. And so maybe even if the tools are there, the doctor might not be willing to. It's possible that, I mean, you know, that insurance might not cover, I don't know, insurance would cover a neurological exam. Basically, you're talking about a neurological exam. And not all neurologists have the eye validation. They tools, they have the other, well, I'm not sure
usually
how many
ear, nose, and throat doctors have that, but they're not going to interpret probably correctly.
So it's tough. So it's a little challenge for you, but here's the deal. People come in here and it's like, okay, everybody said I'm normal. Everybody said I'm fine. And we have them stand there. Dr. Gates talked about balance a little bit. We have them put their feet together and stand on that foam pad he talked about, close their eyes. And sometimes you have to catch them before they hit the ground. And their MRIs were normal, and their CAT scan were normal, and their blood tests were normal. Clearly, they have a bad cerebellum. That's a cerebellar test. So, and then you can rehabilitate that in ways that Dr. Gates talked about. But the point is that most patients who come in here, their symptoms are being treated. So they're being questioned as whether they're trying to get some sort of remuneration from an insurance company, or if that's not involved, they're just being told, you know, we're going to send you out there because we're not so sure that you don't need counseling or something like that. Maybe you're getting medication for depression or anxiety or panic attacks. Maybe you're getting a gut that's being bad. A lot of times you get gut problems right after you get a concussion within a couple of weeks to a couple of months, and so on and so forth. So if that's where you're at, the problem is still the concussion. And so there are ways to go about it, but if you've been led to believe that it's just the MRI and a CAT scan, and if it isn't that, you don't have a concussion, that is incorrect. That's not just us saying that, that's the literature saying that, that's an evolving research world saying that. You can be helped, but before that, you need to really get a good diagnosis, and so you need to find somebody who does these types of things. So that's that.
Well said. So for the references attached to today's broadcast, you need to go to powerhealthtalk.com, look up concussion and brain imaging. That will probably bring up today's broadcast. Even if you search concussion, it should come up. And below, we've attached the references of the newest data regarding brain imaging. And we hope this was helpful. And if you have any other topics you want us to talk about, send them to us. We can't take personal questions, but we can take topics. So thank you so much, and we'll see you soon.